Okay. 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 Good afternoon, everybody. It's my pleasure today to welcome my colleague Emily Peterson. Emily recently joined the National Collaborating Centre for Environmental Health and Environmental Health Services at the BC Centre for Disease Control as an environmental health and knowledge translation scientist. Emily comes from Ontario, where she worked on the environmental and occupational health team at Public Health Ontario. While working there, she was involved in a number of projects, including designing and implementing a metal biomarker study in children under 5, calculating the burden of illness from radon exposure, and developing an online application for mapping ground and surface water contaminants across Ontario. Emily holds a Master's of Public Health and Epidemiology from U of T, where she focused on environmental health. Emily is passionate about the impact that humans have on their environment and, in turn, its impact on human health. And I am hoping that students in my class are going to get some fodder for the introductions for the papers they will soon be writing from this talk. Welcome, Emily.
Thank you, Sarah. Thank you for inviting me to be here today. So today I'll be talking about reducing the lung cancer burden of illness from radon in Ontario. I hope by the end of this talk that you'll have an understanding of radon, the burden of illness in Ontario, and some insight into the complexities of reducing the burden. So the work that I'm discussing today is not work that was done at the current job that I'm at, but it was done at Public Health Ontario in Toronto. Public Health Ontario provides expert scientific and technical advice to public health units, government, healthcare providers across Ontario. At Public Health Ontario, the Environmental and Occupational Health team tackles a wide variety of environmental health issues, and one of them is radon. So this is an outline of the talk that I'll be giving today. First, I'm going to give you a quick background on radon. I'm going to try and get everyone up to speed on this topic. I will then go over some findings from a study that we did to estimate the burden of illness from radon in Ontario. And finally, I'll explore the knowledge to action component of this work. In this part of my talk, I will discuss how we disseminated the burden of illness information, some of what can be done to reduce the burden, and also the related complexities around the challenges we face. So what is radon? So radon is the decay product of uranium. It's a colorless and odorless gas, and its short-lived progeny release ionizing radiation during radioactive decay. Ultimately, when it comes to radon, from a human health perspective, radon is an indoor air problem. So how does radon get into buildings, and how does it become an indoor air problem? So it enters buildings through cracks and openings in the structure. And as you can see in this diagram here, that was produced by Health Canada, pressure differentials between the soil gases and the indoor air drive the transport of radon into the building. And then radon can accumulate in these enclosed spaces. So radon is actually quite well studied when it comes to environmental health concerns, and it has been clearly shown in many minor and also population studies that radon causes lung cancer. People are exposed to radon through inhalation, and it's inhaled into the lungs, and then alpha decay can irradiate the lungs, and that's how we get lung cancer. Radon is an IARC group 1 carcinogen, and it's considered to be carcinogenic to humans from long-term exposures. So an individual's risk is going to depend on a bunch of things, and it's going to depend on their level of exposure, their duration of exposure, and also that individual's smoking habits. So radon and smoking actually interact, and those who are exposed to radon and are smokers are at a higher risk of developing radon-induced lung cancer than people who don't smoke. This effect is thought to be super additive, but it's not quite multiplicative. So they're trying to sort out exactly where it fits in there, but it seems to be a super additive effect. Currently, there's no known threshold for effects for radon. So what can be done about radon? Radon is actually something that we have solutions for. So it's easy to test for radon. You can use alpha track detectors. You can go into most hardware stores and pick up one of these detectors, and you can also buy them online. And they cost about $40 to $50, and they can be put into your lower level of your home that people occupy for about 3 months, and then it's sent off to the lab to have the tests read. Health Canada recommends that homes be mitigated to reduce radon levels if they're above 200 becquerels per meter cube. So that's the current Canadian guideline. And this guideline was recently reduced from 800 down to 200 in 2007. Just to give you some idea of where that fits in with other guidelines, in the United States, the guideline is 148 becquerels per meter cubed, and in the WHO, their suggested guideline is 100 becquerels per meter cubed. So once a building has been tested for radon and it's found to have high levels, it can be mitigated. So mitigation can be performed in multiple ways, but the most common approach to mitigation is through active soil depressurization, which I have a diagram shown here. This is where a piping system is put into the ground underneath the building, and there's kind of gravel fill that's put underneath the building. And then it's vented either out of the side of the building or out of the roof of the building. And what happens is the radon goes through the path of least resistance. And instead of going into the building, it goes through the piping, and often there's actually a fan to help push it along, and then out the side or the top of the building. This approach has been shown to be extremely effective at reducing indoor radon levels. And for a typical home, it can cost maybe between $1,500 to $3,000 to have this put into the home, but it will really depend on that home. The Canadian National Radon Proficiency Program certifies radon mitigators in Canada, so there are people who are trained to install these systems effectively into homes. The other option is to build homes that are resistant to radon in the first place through the use of building codes. So to give you a little bit of background on building codes, the national building codes are model building codes, and they're not legal until it's adopted by a jurisdiction that regulates the construction of buildings. So ultimately, it's the provincial responsibility to set the building codes, and they become law once that jurisdiction has adopted them. In some circumstances, though, the municipalities may be able to legally adopt building codes. I'm going to talk about building codes further, so I just wanted to provide that background at this point. So how important is radon as a cause of lung cancer in Ontario? So when we first started discussing radon at Public Health Ontario, we were actually asked this question a lot. A lot of people wanted to know, why should public health spend their resources on radon versus other public health issues, given that there's very limited budget, such as West Nile virus? So before I get into the burden work, the lung cancer burden calculations that we did, I wanted to give you some background on Ontario for those of you who are not familiar with the province and how public health is organized there. So Ontario has 13 million people, and across the province, there are 36 health units that are responsible for public health. So these health units vary in the size of the population that they serve and also the geographic size of that health unit. It might be hard to see on this map, but there are regions, and within these regions there are the health units in those regions. So the health units are given a budget, and they're also given general guidelines on what they're required to do. But the resource allocation, the program design, the action are all the responsibility of that health unit. So in a setting like this, there's definitely a need for local level research and information. A recent review on the use of evidence in public health found that there was a lack of local level data, and this was a barrier to its use in public health. So where is radon found in Ontario? That's also another question that we got quite a lot. Based on the Health Canada survey of radon concentrations in home, radon is found throughout the province of Ontario. It's very difficult to say where there may be high radon levels versus low radon levels. Even though there are some areas where clearly the levels are definitely a bit higher, it seems to be prevalent across the entire province. And also it affects many types of homes. Right now we can't easily say this home has a higher risk of having high radon levels than that type of home. It seems to be affecting a lot of homes. So really, the only way to know is to test for radon in those homes. So just one thing to know is that as research develops, we may get a better understanding of the type of buildings and also the areas where we find radon, but at this point, we're not quite there. So this is the publication that is a result of the calculations that we did. I wanted to estimate that these estimates are mentioned, that these estimates are based on models and they have their limitations. So as with any burden of illness calculations, we're limited by the models that have been developed and also the data that is available to put into these models. More details on the model and also the data sources, as well as the limitations, can be found in this publication here, but I'm not going to go into the details of those limitations or the methods that we use today. So what did we do? So we set out to calculate the lung cancer burden of illness attributable to radon in Ontario. We also wanted to estimate the number of lung cancer deaths that can be prevented through remediation and perform these calculations separately for each of the 36 health units in Ontario. So just to tell you a few things about the methods that we used, I'm not going to get into the details, but these methods were proposed by Kevin Brand, and they're based on the BEER 6 report on the health effects of exposure to radon, which was done by the National Research Council in the United States. So we estimated the population attributable risk percent for radon by health unit. So the PAR percent determines the theoretical percent of radon attributable lung cancer deaths that could be prevented if all radon exposures were completely eliminated. So I'm going to repeat that again because I want everyone to make sure that they get this. So the PAR percent determines the theoretical percent of radon attributable lung cancer deaths that could be prevented if all radon exposures were completely eliminated. So we also estimated the number of lung cancer deaths that can be prevented if all homes above 50, 100, 150, and 200 becquerels per meter cubed were remediated to background levels. So the three higher cutoffs that we chose represent guidelines, as I had talked about earlier, from other jurisdictions. And the 50 becquerels per meter cube cutoff was included to see what the impact of a cutoff like that would be. So now I'm going to move on to some of the results that we found. So based on this work, we estimated that approximately 13% of lung cancer deaths in Ontario are attributable to radon. So this is equivalent to 847 lung cancer deaths per year based on the 2007 data. So we looked at it based on the 2007 data. That would be due to radon. We found that 84% of these deaths would have been in ever smokers and 16% of these deaths in people who had never smoked. So we did find that there was significant variation in the estimated PAR percent and number of preventable deaths across health units in Ontario. So this table just gives a snapshot of some of the variation between health units using two extreme examples. So on the bottom two rows here, we have two health units. And for each health unit, we can see the estimate of the proportion of lung cancer deaths that are due to radon, the estimated number of lung cancer deaths, which are shown here, and also the estimated number of radon-related lung cancer deaths that could be prevented at 2 cut points. So for Health Unit 1, we estimated that 25% of lung cancer deaths were attributable to radon. And for Health Unit 2, we estimated that 9% were attributable to radon. When you look at the number of lung cancer deaths that were attributable to radon, you can see that they're fairly similar across the two health units, at 21 and 24 lung cancer deaths each year. This is because Health Unit 1 has a much smaller population than Health Unit 2. An interesting part of what you can see from these numbers is actually the number of radon attributable lung cancer deaths that can be prevented, or the percentage of them. So for Health Unit 1, we estimated that if all homes were remediated using the Health Canada guideline to background levels, we would be preventing 5 lung cancer deaths a year, or 23% of the radon-related lung cancer deaths. For Health Unit 2, though, if all homes were remediated to that same guideline, we would actually be preventing none of the radon-related lung cancer deaths. So this finding has interesting implications for policy and an action perspective. So now I'm going to show these results for Ontario looking at the different cut points. So this image shows the reduction in the PAR percent that can be achieved for each health unit. So if all the homes that were above 200 becquerels per meter cubed, the current Health Canada guideline, were remediated to background levels, then we would be reducing the area in red. So each bar on this graph shows you a health unit, and the bar on the very right is for the province of Ontario. And the x-axis is showing you the population attributable risk percent. And as I said, the red portion of the bar shows the proportion of lung cancers, or the proportion of the population attributable risk percent that could be prevented if all homes were tested and remediated using the Health Canada guideline. So if we were so across the province, we estimate that 91 or 11% of deaths could be prevented if all homes were tested and remediated using this guideline. So if we were lower the guideline to 150 becquerels per meter cube, so that's similar to the current US guideline, and we remediated all homes, we estimated that we would prevent 149 radon-related lung cancer deaths, or 18% of them. If we were to lower the guideline even further to 100 becquerels per meter cubed, which is the WHO guideline, and remediated all homes, we estimated that we would prevent 233 radon-related lung cancer deaths, or 28% of them. And finally, if we remediated all homes above 50 becquerels per meter cube to background levels, then we estimate that we would prevent 46% of radon-related lung cancer deaths. So to summarize some of the findings from this work and this paper, we found that radon is an important contributor to lung cancer deaths in Ontario. For some health units, but not all, testing and remediation to the current Canadian guideline may prevent a portion of the radon-related lung cancer deaths. And a large portion of radon-related lung cancer deaths in Ontario are from exposures to levels below the current Canadian guideline. As shown earlier, we estimated that 11% of radon-related lung cancer deaths could be prevented if all homes were tested and remediated using the current Canadian guideline. So an important thing to keep in mind while we're looking at this is that this will be different in different provinces, different health regions across the country, depending on the distribution of radon levels in those areas. So the next logical question, after we sorted out what the burden was how do we go about reducing the burden? So we're in public health, so the next logical step is education. So in addition to publishing our work, we provided the health unit specific results to each individual health unit. And then we also made infographics that were posted on the website. So we created 2 infographics. The first infographic is this basic one that's shown on the screen. And this one was used to communicate Radon 101 and the results of our burden calculations. And this can be found on the Public Health Ontario website. And so it gives you a basic overview of what is radon, what can be done about radon, and then also some information on the estimates that we created or generated. So this second infographic that we created was more complex. It had some more in-depth information in it, and about the intricacies of radon and risks and remediation and also exposures. And this infographic was specifically geared to health units across the province, and it can also be found on the Public Health Ontario website. So if anyone wants to look at it in detail, you can go there and download it, post it on your wall, whatever you feel like doing with it. So the work that we did was also brought up in the Ontario Legislative Assembly debate in both 2013 and 2014. I would attribute this to good timing. It wasn't that they talked about it because of our work, but our work was coming out at the time that they were talking about radon. So these are two quotes that came from the legislative debates. And the work that they were discussing was, or debating, was a bill that focuses on radon awareness. It establishes a radon registry, and it requires testing in public buildings. So in its current form, it's called Bill 11. Each year it kind of doesn't quite make it through and then turns into a different bill. And it's the Radon Awareness and Prevention Act. It's now passed 2 readings and has been carried to a standing committee in general government. So legislation like this currently does not exist anywhere else in Canada, and it'll be interesting to see what happens to it in Ontario. It doesn't necessarily mean that it's going to go forward because it's sitting where it is right now, but it's now gotten to a point where they're discussing whether or not it's going to go forward or when it would go forward. So this is all really fantastic. So we've sorted out what the burden is, we've sent out our infographics, we've given the information to the health units, and we have gotten some information into the legislative debate. But reducing the burden is actually not so simple. So translating the work that we have done into action is not as straightforward as we would hope. So I'm now going to speak a little bit about the complexities we face when trying to reduce the burden of lung cancer from radon in Ontario. So our current public health approach to tackling radon is to educate the public about radon and its health effects, and then encourage homeowners to go out and buy test kits, put the test kits in their home, then send the test kits out to the lab, and then wait for the results to come back. And then if the results are high, which are above the current Canadian guideline, then we recommend that they go and find a remediation contractor and then remediate their home so that themselves and their family, and hopefully the people that are living in the house after them, are not exposed to radon. So that's kind of the approach that public health is taking pretty much across the globe right now to try and encourage. There's other things happening in other jurisdictions, but that's kind of the main approach to dealing with radon in homes. So some of the challenges with this approach is that it puts the onus on the individual to carry the costs of testing and remediation. But at an individual level, these risks may not actually seem like it's worthwhile to go through all of that and to do the remediation. If we think that the levels that we want to remediate are around 100, the risk for the individual is one thing, but then when you're looking at the population risk, that's when you start to say, okay, this is a big issue. So to get an individual to go out and do all of these things and understand why they're doing it and what they're doing it for, and also put the money towards it, can be extremely challenging. So one of the questions that we ask is how many homeowners actually test for radon? So a very recent survey by the Canadian Cancer Society, these are people who answered a survey about radon, found that 96% of Canadians have not tested their homes for radon. So studies in other countries that are more active with radon awareness suggest that maybe 15 to 25% of people who respond to a radon survey have tested their homes. So of those who test, an even smaller number actually remediate their homes. So right now there's no Canadian data on this, but some US surveys have found that between 30 to 40% of people who have tested and found that they have elevated radon levels based on their cut point in their country, which is actually the US, actually remediate their home. So we're only having 30 to 40% of those people who have gone out and tested, found out that they have high levels, remediating their homes. So then the other question to ask is who is testing and remediating? So is it the people that are at increased risk that we would expect, maybe smokers, people living in basements who are exposed for all of the day versus people who are living on top floors versus bottom floors in big houses? And the literature suggests it's not the people that are at most risk. Some of the factors that have been associated with people remediating were having a higher education level, concerned about real estate value, and having owned a home of 10 years or less. And those who were smokers or unemployed were actually the least likely to remediate their homes. The other thing that we need to think about is the people that are renting and what impact that has on the people that are renting, which I'm not going to get into detail today, but that's another important thing that needs to be considered. So even if everybody in Canada tested and remediated their homes to the current Canadian guideline, we would still only be addressing a small portion of the burden, as I showed earlier. which is, we were saying, was approximately 11% of the burden. But having said this, testing and remediation is actually the only option that we have come up for older buildings right now. And many of the health promotion theories suggest that awareness is one of the first steps that an individual must go through before they start to take action. And so there are these theories that talk about the steps of behavior change, and it starts with awareness and it ends with action. And so potentially we're just at that awareness stage and we don't even have really great awareness. So maybe that's what's going on. But we also need to look for other ways to get people to test and remediate their homes. So there have been some suggestions in the literature that if financial barriers are removed, this may improve the testing and remediation rates. But right now, there's very little evaluation of the effectiveness of these programs, and so we're not completely sure what impact this would have. In Ontario specifically, right now, there's actually little to no public building testing happening. So in other provinces, I think such as BC as well, there has been some school building testing and some workplace building testing. In Ontario, that hasn't really happened, unless there's large outrage for one school and then maybe they would test that school. So schools and long-term care facilities and places like that are not being tested. So one of the theories or questions that we have is, could public building testing increase awareness, which then prompts people to test their own homes? If you send out a letter telling everyone that they're testing the schools for radon, would people then decide, okay, I'm going to go test my own home as well? It's kind of a lead by example approach, potentially. Also, as we move forward with a testing and awareness approach, it's extremely important that we continually evaluate the work that's being done and determine what is an effective approach. Because at this time, there's very little research out there to suggest what approaches are effective versus less effective. So another route to prevention is to design and install effective radon preventative measures into buildings during their initial construction, and this would be through mandatory building codes. This is a long-term approach, but it could be arguably more effective at the population level and also more cost-effective than a retrofitting approach where we go into each home and remediate those homes. But of course, there are also challenges to this approach as well. At this point, there's little research on the effectiveness of building codes to reduce radon levels in Ontario. So other regions have adopted various types of building codes that may or may not be applicable to the Ontario climate and also the Ontario geography. Also, there is little research on the building codes to determine what is actually effective and what is not. So the current Ontario building codes are actually not consistent with the new national building codes regarding radon. So there are national building codes that were released that say this is what should be done for radon, and Ontario has chosen not to take those building codes in at the provincial level, which means that they're not legal. However, Ontario claims that the building codes that they have right now are protective against radon. And recently, some questions have been raised about the effectiveness of the national building codes in reducing radon levels. But again, there's very little research on this, so we really don't know the answers at this point. One thing that I'd like to bring up is even if there are building codes in place, the next question is, does the construction industry follow them with the detail that's required to prevent radon entry? So for example, you're putting a membrane underneath the building as one approach, and then there's a bunch of other things that are also happening. And if a small hole was made into that membrane barrier during construction, what impact could this have on the radon levels in the home? So there may be a need, if we do implement effective building codes, to still test homes post-build after the homes have settled to ensure that radon levels are low. The good news is that new building technologies for radon are actually being developed as we speak. Some of them are being developed specifically for Canada. And these technologies, we will see over the coming years about their effectiveness. And they are kind of packaged things that you would put into new buildings and new homes, which would then help with the remediation that may happen later on. But right now, we need to still suss out what the effectiveness of these technologies are. So the other question related to building codes is, how quickly do homes turn over? And when would all homes be protected with these new building codes? So in our paper, we estimated that it would take about 37 years for 50% of new homes, for 50% of homes in Ontario to be built to that new standard. So in our rough estimates, we were thinking that new building codes could prevent between 20 and 50% of the burden 30 years from now, depending on how low we can get the radon levels in those new homes. And we'd have to also take into account the appropriate lag time. So these challenges highlight the need for the development of promising building practices and also to continually evaluate the intervention work that's being done. So an interesting development in the radon story in Ontario is that new home warranties in Ontario now include radon. So this means that new homes that test above the current Health Canada guideline are covered for remediation for up to 7 years after purchase. So a homeowner would have to know about radon, test their home for radon, and then make an insurance claim to do the remediation. But this leads one to ask, if a homeowner is aware of radon, and would this warranty provide the economic incentive that is needed to drive the remediation of their home? So would they, maybe after buying a $500,000 home, it's this brand new home, put the blame on the builder and say, this home is not healthy. I should be getting a healthy home because it's my new $500,000 home that I just got built. And therefore, my radon levels are high, someone should be paying for this. Oh, look, there's a warranty, now we're going to get someone to pay for this. So maybe that is an approach to provide that financial incentive and also that drive to do the remediation and the testing. But again, if we don't install effective radon-resistant building technology into the building while it's built, and we're only remediating all new homes using this warranty, and we're using the Health Canada guideline, we're still only preventing a portion of the burden. So could it make sense to lower the radon guidelines in new homes? It's just a question. Another question that I have is, could these home warranties be a way to drive building for prevention? So if we were to increase awareness of radon, and then we were to decrease the guideline levels, would that increase insurance claims? And then would the builders eventually get fed up of all of these radon-related insurance claims and then start to build for prevention? So these are some interesting intricacies with this new home warranty, and it's actually a new development in Ontario, so we're not quite sure what impact it will have or where it will go. So I just wanted to summarize some of the potential next steps based on kind of all of this stuff that I've just given you guys, which I know is a lot. So, I mean, we can continue to increase awareness. It's probably one of the only options that we have for older homes. However, in conjunction with that, we need to start considering a lower radon guideline if we want to be preventing a larger portion of that burden. We also need to continue to develop radon-resistant building technologies, because if we can build homes that have low radon levels, like low radon levels, like maybe 15 or 30, then we're getting a much larger chunk of the burden than we are for testing and remediation to even 100 or 150. And the other thing is to consider the role that home warranties play in this whole public health radon prevention approach that we're taking. So just for radon, kind of pulling it out a bit bigger and talking about radon in summary, for many environmental health issues, we don't necessarily know the concrete health impacts. We're still studying them. We can't necessarily estimate the burden very well. There are plenty that we can, but there are also some we can't. Sometimes we can test for them, but often the clear interventions are not necessarily available. So for radon, we know the health impacts, we can estimate the burden, we can test for it, and there are interventions available, yet somehow reducing that burden is still going to be so complex, and it's going to be, from what we can see, a pretty long journey. So before I end this presentation, I just wanted to acknowledge the people who worked on this project, and also tell you a little bit about where I am right now. So Ray Copes is the Chief of Environmental and Occupational Health at Public Health Ontario. Lennon Lee is the biostatistician who I worked with closely on this project, and he played a huge role in this work. Jenny Kim is a public health physician who worked on this project as well, and Amira Acker and Elena McIntyre, who are also at Public Health Ontario, well, Amira is no longer there, have played big roles in radon, and Elena is kind of continuing this work there in Ontario as we speak. Kevin Brand is at the University of Ottawa, and he also helped us with this work and these calculations. We also involved the Public Health Ontario communications team and also the central analytics team. So there was a lot of players that were involved in different points along this kind of radon work. So I'm currently working at the BC Centre for Disease Control and also the National Collaborating Centre for Environmental Health. So just to give you a little bit of information on them, the National Collaborating Centre for Environmental Health is one of 6 national collaborating centres across Canada and is funded by the Public Health Agency of Canada, but it's housed in the BC Centre for Disease Control. And the BC Centre for Disease Control is an agency of the Provincial Health Services Authority and is one of 3 provincial public health agencies across Canada. The other 2 are the INSPQ and in Quebec, which is in Quebec, and then also PHO in Ontario. So thank you for listening to my talk. I left a lot of time for questions and discussion if anyone wants to talk about anything or have any questions. So thanks a lot for being here with me today.
Hi. Do you know any other variables that can be used to predict indoor radon concentration?
Variables. That's actually to predict the indoor radon concentrations in a building?
Yes.
And you want to
In
know?
a building.
Oh, that's actually a very good question because it's extremely important research because right now we don't know the answers to that. So determining what variables in terms of the way the building is built and also the geography in the area is a great question that really needs to be answered. So I look forward to hearing about the results of your work.
Hi, thank you. I was wondering, when you were talking about incentives, has there been any consideration of maybe having a radon test being a condition of sale or title transfer or something along those lines?
Yes. So the U.S. has actually gone that route. There is some, I think it's not all states, but some states, someone can correct me if I'm wrong, who require that a home be tested for radon at the time of real estate transaction. However, there have been quite a few challenges raised with that because to be able to test for radon levels fluctuate, and to figure out what a person's exposure is over kind of their lifetime is what we're looking at, or over their year. You need to put a test in the home for about 3 months. And so when you have these quick transactions that happen, what's happening is that people are putting in testing for 1 or 2 or 3 days. And whether or not that actually represents someone's exposure is quite questionable. And then on top of that, the follow through to remediation has not necessarily happened. So, I mean, someone could put a tester in and open all the windows and then, you know, for 2 days before they sell their home and say, oh, look, the levels were quite low. So the U.S. Has not necessarily suggested that that's been an effective approach to actually reducing the burden. But it's a great idea.
I'm just curious if there's much within home variability in radon, or are the levels fairly constant in like every room within one house?
So radon levels tend to be much higher on the lower levels of the home. And then kind of as you go up in a building, the levels will decrease. So if you're in like a tall high-rise condo building, typically the levels are not quite high on the upper floors. But in terms of within building variation, so definitely in places like schools, you will see variation from one room to the other depending on kind of the airflow and also where the radon is coming in. In buildings, in homes, sometimes crawl spaces have pretty high radon levels. So it really depends on that home and that building. So there are, when we test, we recommend often, if it's a bigger building, to put radon monitors in multiple rooms and not just an individual room. And typically, as you go up, the radon levels do decrease.
We actually haven't sat down and talked about radon yet in terms of our professional capacity together. I don't know, have you read our radon report to Harry Kendall, the public health officer in British Columbia?
I have not seen that.
You have not seen that. Okay,
No.
so I am deeply struck by all of the similarities between what you put together here and what we've done there. And, you know, especially around building codes and if we built to keep radon out, what the impacts would be. And I'm struck by the similarities because BC and Ontario are quite different contexts when it comes to radon and radon exposures. But the conclusions are almost exactly the same. So, you know, you said earlier in your presentation it would be province dependent, but based on what I've seen of what you presented and what we've put together, that's not true. It might be sort of what you've done here and what we've done in BC might be sort of nationally applicable.
Yes. Yeah, I do agree with that. I think a lot of this is actually quite nationally applicable. The province-dependent point is more actually in relation to the guideline. So, and the proportion of the burden that we're reducing. So if we some of the provinces that have extremely high radon levels, for them, a guideline of 200 may actually be quite protective for a lot of the radon burden. But for provinces where levels are lower, then it's probably quite consistent in terms of what approaches we need to take and where we want to go with that. But it'd be great to talk further about that and also see that report would be fantastic. Yeah.
So
Hello.
if I understand you correctly, people test their home. If they are above the guideline, 200 becquerels per cubic meter, then you advise them to remediate.
Health Canada does, yeah.
Okay. I'm wondering if that's the case in Ontario too, because I'm just wondering that, okay, when you talk, that only takes care of about 11% of the burden. So why won't you advise them to remediate even if it's lower than that?
That's a very good question. So Health Canada takes the approach of 200 and suggests that people remediate their homes at 200. Public Health Ontario, so the organization that I was working at, actually doesn't create policy and doesn't actually provide the advice. So we're tasked with providing the scientific and technical advice to other government bodies, such as the Ministry of Health, and to the health units. And then they're the ones who can make the decision of what approach they want to take. So that's a question that we've also asked, but I think the radon conversation in Ontario hasn't probably gotten further enough along at this point to make a decision to say we're going to go somewhere different than Health Canada. And also, right now, all provinces are following the Health Canada guidelines. So, but it's a great question. And maybe there needs to be variations in guidelines across provinces depending on the distribution of levels.
All right, we have a question from an online listener, and then I'll give it to you. The question is from Philip Chen, and it says, just wondering how you address the effect of smoking while calculating the PAR, especially the combined effect given that the combined effect might be super additive.
Yeah, so we included both smokers, ever smokers and never smokers in our model. And so ever smokers were people who had smoked, I can't remember the exact numbers, and I can get those to you, but I think it was about maybe 5 packs or 5 cigarettes in their lifetime. And then never smokers were people who hadn't done that. The way that we included smoking into the model was we followed the Beer 6 approach, which is, I can try and bring you some. So this is kind of the methods that we used in the model approach that we took. And so we included lung cancer mortality from smoking, and we included the prevalence of ever smokers, and then also the relative risk of all-cause mortality from smoking, and put that into the model. I can show you the model later and all of the intricacies and numbers that go into it, and we can have a discussion offline about the details of that. But it was kind of a crude inclusion, I would say, of smoking because we were looking at ever and never smokers. And the reason we did that is that we're trying to keep consistent with that, the methods that were developed in the US, which they also did this crude inclusion. But it would be nice to see analyses that didn't have such crude inclusions of smoking and non-smoking.
Great presentation. Thank you very much,
Thank
Emily.
you.
What I wanted to say is that not so much a question, but you know, uranium and rock's been around for a long, long time. It just struck me when you said that it's this topic of radon and health, public health, hit the Ontario legislation just on 2013. I don't know. I assume that it just kind of hit it at that level, the political arena in 2013. This struck me as like, okay, it's good. At least it's there, and it's only one province, right? It'd be nice if this become a more national undertaking at the higher political level. But it's good that I know Health Canada is working very hard to raise awareness. The lung associations are all doing that, and so here's an aside. Health Canada has a free online course on radon and health aimed at health professionals. So if any of you are interested in learning more, you can. It's offered through McMaster University. So, anyways,
yeah. And they also have a fantastic array of background documents, information, pamphlets. They have Health Canada has done a really big push since I think about 2007 with radon.
Yeah. So my sense is that because smoking is exerts such a huge multiplicative effect, and as a population health threat, smoking is still something that needs to be reduced at a population level. So I definitely educating the physicians and other health professionals, and when they serve their clients, their patients, that's really key. But the level of what needs to be raised in awareness too at a much more massive campaign. So it all has to do with messaging in the health hazard of radon has to really step forward, like has to be really magnified, because it's just something I just happened to have looked at yesterday. That's from a StatsCan report. It was just 2013 that apparently majority of Canadians, over 80%, did not correctly identify radon as a health hazard.
Yeah.
So we're still a long ways away. You know, we can talk about home warranties. I mean, it's good, building codes, all that, but it's the buy-in, right?
Yeah.
And actually getting that mitigation through.
Yeah, and that's a good point. And I think what's an interesting observation that I had, so the US actually started with their kind of promotion or campaigns many years ago. I think it was sometimes in the 80s. And so Canada just started recently. And I have family in the US, and when I would tell people what I'm working on here in Canada, I would say I'm working on radon, and everyone would give me a huge blank stare. Like, I do not know what radon is. When I went to the US and told my family I'm working on radon, they were all like, oh yeah, I know what radon is. Oh, my neighbor tested their home for radon. And it was interesting, the dialogue, the differences between those two jurisdictions. So we do have a kind of a bit of ways to go getting Canadians to even know that radon is a health hazard. Yeah. Oh, actually, I just wanted to respond as well, sorry, to your smoking comment. And so some people have suggested that because a large chunk of the burden is related to people who smoke as well, because of the interaction of the two, there's quite a few people who have suggested that maybe tackling smoking is actually the better approach to take than tackling radon. And there's some literature suggests that that's actually quite a cost-effective approach. If we can get the population to stop smoking, then radon would not be as big of an issue. But one of the challenges with that is that, I mean, we've done a great job at reducing smoking in the population, but we're still kind of hitting a point where it's not necessarily moving that much further. So if we can't get smoking levels down, what do we do next?
I'm just going to jump in on that as well. I mean, one of the arguments against putting all of the onus on reduction of smoking is that it doesn't actually protect the non-smokers from radon. Yeah. And in our modeling exercise, we also looked at the additional benefits of reducing smoking on top of bringing radon down to its lowest possible concentrations via building codes. And there is a significant added effect. So really tackling the two together makes best sense from my perspective.
Yes, thanks, Sarah.
So I actually want to follow up on Lydia's question and something you said earlier about the education. And there must be lessons to be learned from the U.S. experience. So I was there in the 80s, and there was all this education. And my sense was actually nothing happened until the disclosure agreements went into effect. And as you said, they're not throughout the whole country, but there must be lessons to be learned. It just seems like right now we're repeating or sort of starting over, reinventing the wheel, and there's really no need to do that. Also, many countries in Europe have been dealing with this for 30 years. So can you give me a sense of sort of why, why we're trying to reinvent the wheel, or what the barriers are?
So I think as we move forward, I think it makes sense to start talking to key people that have been involved in the US and Europe. One of the tricks is that it doesn't seem like we have done a great job at documenting the effectiveness of programs. So when we're looking at the literature, there isn't a whole lot that we can find in the US and Europe literature that suggests like these approaches work and they're consistent. And it may be because approaches were taken and then the evaluation of those approaches did not necessarily get followed through, or maybe it did and it's hidden somewhere else and it's not making it in. So there are studies out there that are looking at radon and an effective approach, and there are some things that have been shown to be effective. The trick is that from my take of the literature, I haven't done a huge systematic review of it, but through reading through it, I can't quite find anything that seems to be consistently working in lots of jurisdictions based on what's published right now. But the financial incentive side of things is one question. Some people are looking at trying to talk about smoking and radon together, and if that impacts the way that people are anxious about, like if they say, I'm going to continue smoking, then maybe I will be worried about radon. And so some people have been looking at some approaches, and there are some things that are working out there. So it's not that nothing is working at all, it's just that we're not getting levels super high in terms of awareness and testing and remediation. But I do agree, I think some conversations need to be had with those people who've been tackling these issues for quite a while in other countries.
Elena's jumping in from Ontario to say the U.S. experience has taught us that radon maps are not useful tools for educating the public.
Yes, we do know that. That was definitely one key thing. I think the two learnings that I've heard over and over again was the radon map one, and also the real estate transactions. Both of those didn't seem to work quite well. Because people with the radon map, people will look at the areas where it's a bit lower and say, oh, great, fantastic. Whew, I don't need to test my home at all. And that's not really the messaging, because there are still homes that are high in those areas where levels are a bit lower. But they may be more effective actually from a policymaker implementing kind of like which areas do we want to tackle first perspective, but less from a public education perspective. Thank you, Elena.
All right. Well, if there's no further questions, I think we should all go out and enjoy that beautiful day while we can. Thank you very much, Emily.
Thank you.